The legacy impacts us in a way that we see that it's important to be a primary health care for all, regardless of anyone's backgrounds, what their jobs are. We treat our patients fairly. All of our patients get served equally, regardless of their insurance status, regardless of where they work, what they do for a living. We want to make sure that everyone has equal access to health care.
It really puts a lot of things into perspective, because these people spend all day working, and they do it selflessly. They do it in a way where all they care about is providing for their families, whether it's here or their families back home. And with that said, they don't really care about anything else, whether they're hurt or whether they're sick.
I grew up not having access to healthcare, but I remember my mom, came across and someone said like Clinica Adelante or Adelante Healthcare, and so anytime that we would get sick, or she knew that at least if we didn't have insurance at that time, like that they would be able to work with our family. So to this date, my dad still goes to Adelante Healthcare in Wickenburg, so it's just really neat to see. And when I started working for the migrant education program and learning more about the history of Adelante Healthcare, it's just seeing that this was a program that was created for the farm working community.
So one of the things that we do is we develop partnerships with organizations that work with farm workers. There's a lot of partners that we work with where we'll coordinate events to provide health services at the farms or at locations where we know where the farm workers will meet, so that we can provide them the services that they need at a time that works for those families.
The migrant education program was enacted in 1966. It was enacted to reduce the barriers faced by migratory children and youth due to the migration pattern. So we provide the scope, we provide the support, the structure to our local educational agencies so that they could provide the support to students in the classroom, inside of the classroom, outside the classroom, and ensuring that our migratory students will graduate from high school or complete a GED. We see that partnership in terms of collaborating, working together in the field, but also Adelante Healthcare has gone and done trainings to our staff that, when we have our boot camps, they're always there providing resources, information that could go back to our families.
When we do the health screenings include getting blood pressure and glucose screenings. And when we find that somebody has elevated blood pressure or glucose, we'll have a nurse on site that will help to provide information to bring awareness as to how they can increase and improve their health outcomes. We also will, at that time, try to assist them with scheduling a primary care provider appointment with one of our health centers. And if we need to assist with transportation assistance, we'll help with that as well.